to all of you. Next one.
Next is Dr. BRINDA RAVI, free paper 36.
Good afternoon, everyone. My paper is on the study of etiological factors and ocular features in children with cerebral visual impairment, a hospital-based cross-sectional study. So what is CVI? Cerebral visual impairment is an overarching term covering a wide range of visual and perceptual visual impairments resulting from injury to the retrogeniculate visual pathways and oculomotor control. So how does brain interpret the image? Occipital lobe is mainly the printer, that is, it prints the image we see. Temporal lobe is the visual library and posterior parietal lobe is the mapper and the doer. And from the occipital lobe via the ventral stream, image reaches the temporal lobe, and that is how we recognize the face, objects and shapes. And via the dorsal stream, it reaches the posterior parietal lobe, and it helps in making a 3D internal map of the visual field. In children with cerebral visual impairment, these dorsal stream and ventral stream is damaged. So recently, CVI has become the most common cause of visual impairment in children in developed countries. This is probably due to improved management of the treatable causes of childhood blindness like cataract, glaucoma, retinopathy of prematurity, and improved intensive care of infants and children. In India also, the prevalence of these children is increasing because of the improved perinatal care. So these children will have disorders of eye movement like strabismus, nystagmus, visual field defects. Since it is often difficult to examine such children, some of these issues may be missed. The purpose of our study was to understand common etiology of CVA in our population and common ophthalmic problems that they have. The objective of my study was to identify the etiological factors of cerebral visual impairment in children, to describe the ocular features of CVA in children, and to study the visual evoked potential in children with cerebral visual impairment. Materials and methods. Review of children with a diagnosis of cerebral visual impairment in the age group of 1 to 5 years at Department of Ophthalmology, Regional Early Intervention Center, Government Medical College, Thrissur, from a time period of 2022 to 2023. Inclusion criteria: children aged 1 to 5 years with confirmed diagnosis of CVI. Exclusion criteria: children with profound visual loss due to congenital cataract, glaucoma, or any other ocular pathologies. Sample size was calculated based on the study by Khetpal V, and it was found to be 59. Study tools: pre-tested semi-structured questionnaire, pen torch, illuminated toy, retinoscope, direct and indirect ophthalmoscope, MRI records, and VP. Visual function was assessed by Leah's paddles for preferential looking test, Leah's symbol chart for preschoolers, and colored lighted toy, and using Leah puzzle, Leah mailbox, hiding headache contrast sensitivity charts. Visual function was then graded from 1 to 6. Diagnosis of CVI was made when the ophthalmological findings did not explain the visual performance of the child and there was associated neurological pathology. Study procedure: using a semi-structured questionnaire, all the information and the histories were collected, their medical records were analyzed to determine the cause of illness, and the child's visual function was evaluated and graded from level 1 to 6. The pupillary reaction was checked, strabismus and nystagmus was checked, fundus examination was done, and cycloplegic refraction, MRI records, and VEP was analyzed. Results: there was no significant difference in the number of children in the socioeconomic status. Age group 2 to 3 years old children were the most common among our study group. Etiology: postnatal hypoxia was the most common cause, followed by perinatal hypoxia, seizures, preterm birth, hypoglycemia, infections, and hydrocephalus. Antenatal history: few of the mothers had intrauterine infection, intrauterine drug exposure, and trauma. Systemic illness of mother: majority of the mothers did not have associated systemic illness. A few had gestational diabetes mellitus, some were over diabetic, and few had pregnancy-induced hypertension. Out of the 59 children we studied, 23 were preterm with low birth weight. Developmental history: 56 of them had delayed milestones, 18 had physical disability, and 8 had hearing disability. Neurological finding: the most common one was microcephaly, followed by cerebral palsy and autism. Strabismus exotropia was the most common type. Nystagmus was found in 19 of them. Refractive error: symbol hypermetropia was the most common, followed by hypermetropic astigmatism and mixed astigmatism. Visual function, most of the children who attended had profound visual loss and showed occasional fixation with no following. Fundus examination was normal in majority of them. VP was abnormal in 15 of them. And the MRI records, most of them had periventricular leukomalacia followed by hypoxic ischemic encephalopathy. So to conclude, the most common cause of CVA was found to be hypoxic ischemic encephalopathy and periventricular leukomalacia, mainly due to postnatal hypoxia in our study. Majority of the children who came to a clinic had profound cerebral visual impairment and had very poor visual function. Some of the causes like neonatal hypoglycemia can be detected and treated early so that CVA can be prevented in them. Children who had a stormy perinatal and postnatal period should be in regular follow-up, which can be combined with ROP follow-up, and if there are signs of visual function deficit, MRI is indicated. If CVA can be detected early, such children can be visually rehabilitated accordingly, and this needs a teamwork consisting of the treating pediatrician, gynecologist, ophthalmologist, vision therapist, and the parents. In view of increase in the prevalence of CVI, there is a need to include special training of evaluation of these children as an integral part of postgraduate and fellowship training program. These are my references. Thank you.
You have included neuro at least as a brain. That's what sir is telling. Okay. Okay, ma. Why did you exclude cataract and glaucoma?
That is to differentiate cerebral visual impairment from ocular visual impairment. Those are the causes of OVI.
They could be super error also.
Yes, sir.
Thank you.
Thank you, sir.